Hello, good afternoon. Welcome to today's Facebook Live session brought to you by Assunta Hospital. My name is Diana, and I'll be your moderator for this afternoon. Before we dive in, don't forget to click share now to spread important health knowledge with your friends and family. Together, we can create more awareness and even help save lives. Thank you for spending your afternoon with us. Today, we are extremely honored to have with us Dr. Ganasan, the emergency physician, as well as the chief medical officer at Assunta Hospital. Dr. Ganasan brings with him years of experience and expertise, and today he will be sharing valuable insights on dengue fever, including symptoms to watch out for, treatment options, prevention tips, and what to do if you or your loved ones are affected. This topic is especially important with the dengue cases in Malaysia. Awareness and quick action can make all the difference. Throughout the session, feel free to drop your questions into the comment section. We'll have a live Q&A after Dr. Ganasan's sharing. So welcome, Dr. Ganasan. Thank you for being here with us today.
I didn't hear. Start again. Again. Start from good afternoon. Hi. Sorry, there was a technical issue there. A very good afternoon to everybody. Thank you for joining us in Assunta talk. My name is Dr. Ganasan. I'm the consultant emergency physician. Today, I'm going to talk to you about none other than dengue fever. So I think whoever lives in Malaysia have heard about dengue fever before. So I'm going to give you a bit good review on the disease and what to expect, what are the phases, what are the danger on dengue fever. Hopefully, this talk will give you a bit more awareness and will give you an idea on how to monitor yourself, how to look out for any danger warnings that comes to you when you have dengue infection. Okay. All right. So these are the contents. We just move on from the contents. Slide number. Okay. So like I said before, yeah. Malaysia is experiencing rise in dengue infection, okay, since 2000 or since much earlier than this. Every year, we see there's a spike and the rise in dengue infection, and every time Ministry of Health comes out with the report, weekly report, we see there's a constant rise in the dengue infection. What is also concerning in the epidemiological report that has been released by the Ministry of Health is that we also notice there's an increase incidence of death because of dengue fever. Now, like any other disease, dengue fever management has improved, and also the infection has become more complicated compared to how it was used to be about 10, 15 years ago. So the disease progression has worsened, hence the outcome of the disease also has worsened. All right. So now the next slide. Okay. So now when we talk about dengue, right, there's two types of dengue that we want to look into. Okay. The first one is the stable dengue. We'll talk to you about what is stable dengue later on. and the one which is more severe dengue, yeah. All right. So allow me to speak some Malay as well, so that it is more easier for everybody to understand. So the stable dengues are the dengues that doesn't require admission. Most likely, they will be discharged and they will recover well. Now, the dengue that actually causes death is what we call as severe dengue or dengue shock, all right? It's basically because unrecognized disease, meaning uh, at times when you have fever, 2 to 3 days time, days of fever, you will tell yourself, I think it's just a normal fever lah. Just take some Panadol and then we'll see how it goes. You know, so when your perception is such and you present to any healthcare center, pretty much later than 3 to 4 days, okay, and then only the diagnosis has been captured, then it is a bit too late for us to do any urgent intervention at that point of time, because um, the disease progression has progressed to become more difficult to manage. So that is what you call as unrecognized disease. Unrecognized shock, unrecognized bleeding, dehydration, and late presentation. Some are the other reasons why dengue fever can cause death. Of course, unrecognized shock and unrecognized bleeding is basically where it is diagnosed in the hospitals, all right? Dehydration is because when you have fever, you tend not to drink enough water, then you become in a dehydrated state. Okay, before even we move on to other slides, right? Okay, I just want to tell you, the main way to treat dengue fever, all right, when you ever have dengue fever, is by replacing the fluids that you're losing because of the dengue, all right? There is no any special antibiotics. There is no any special medication to be given so that you can come out of the dengue fever. Like if you have sore throat, if you have any bacterial infection, most of the time when you give antibiotics, you become better, right? But dengue is not like that. There is no any other any medication other than fever control medication, which is your Panadol or PCM, or the fluids. The fluids is either the amount of fluids that you drink or the amount of fluids that we actually administer in your body. Okay, next slide. Okay, so how do we get dengue fever? Basically, it's because of mosquito-borne infection. It's a mosquito-borne infection called as flavivirus. Okay, the main culprit for this is actually Aedes aegypti. All right, Aedes albopictus is there, but it's not as prevalent as Aedes aegypti. Now, we got 4 types of dengue virus. Dengue maksudnya ialah dengue virus. Kita ada 4 jenis, right? Dengue 1, 2, 3 dan 4. Okay, so sepatutnya, okay, in reality, you can be infected by dengue fever 4 times in your lifetime. So it could be Den 1, Den 2, Den 3, Den 4. If you're very unlucky, you will get Den 1, Den 2, Den 3, Den 4. So, but let's say if you get dengue virus 1, you wouldn't be getting infected because of dengue virus 1 again. The next infection could be because of dengue virus 2. So there's total 4 times. 4 kali ya. 4 kali you can be infected because of dengue fever. But in Malaysia, the most prevalent one is Den 1 and Den 2 lah. Okay. So like how I said, if you get dengue infection because of dengue virus 1, you get lifelong immunity. Maksudnya kalau dah dapat infection disebabkan oleh dengue virus type yang pertama, seseorang individu tidak boleh dapat dengue fever disebabkan oleh dengue virus type 1. Tapi dia boleh dapat dengue fever disebabkan oleh dengue virus type 2. Okay? Alright, next slide. Okay, so antara semua carta-carta yang saya akan tunjukkan kan, carta ni adalah yang paling penting ya. Okay, so if you can give a bit more concentration in this slide. Now, generally, right, dengue fever got 3 phases. Alright, 3 fasa dalam dengue fever. Fasa pertama ialah febrile phase, fasa kedua is critical phase, and third phase is recovery phase. Now, out of all these three phases, right, the most dangerous phase is actually your critical phase. This is where everything happens. Okay, your shock, your bleeding, your organs like your liver, kidney, your heart, your brain impairment, okay, all happens in the critical period. Okay, so what is actually all these phases? Okay, let's go through one by one. Okay, first phase, febrile phase. All right, febrile phase is basically happens on the day 1 of infection up to day 3, sometimes can be up to day 4. Okay, so dalam fasa ni kan, simptom dia adalah lebih kurang macam simptom demam biasa-biasa je. Okay, demam dia tinggi, very high fever. Alright, akan ada rasa badan sakit-sakit, tulang belakang sakit, otot-otot sakit. Alright, mungkin akan ada muntah, okay, ataupun sakit perut sikit-sikit. Alright, dan poor oral intake ataupun tidak boleh minum banyak air ataupun tidak boleh makan. So in this phase, in this febrile phase, because of these symptoms, which is very common in any sort of viral symptoms, what happens is some of us will take it lightly. Alah, demam je kan? Okay, makan je ubat Panadol dulu, kita tengok macam mana besok. Alright? So, there goes day 1, there goes day 2, there goes day 3. Dan bila dah sampai hari keempat, where you're already entering into a critical state, this is where all the complication happens. Masa tu je kita tersedar, oh mungkin ni bukan demam biasa ni, mungkin ni adalah demam yang berlainan. So then only kita akan pergi tengok dekat doktor. Alright? So the febrile phase basically is more on a dehydration state because of your fever, poor oral intake, and vomiting. Okay. Whereas in the second phase, which is your critical phase, all right, this is where, all right, a lot of complication actually happens. This is where very close monitoring and very important examination has to be done. Okay, why do I say that? Okay, semua orang tahu kan bila kita dapat dengue fever ni, kita punya darah kuning tu akan menurun bersama-sama dengan kita punya darah putih. Okay, so bila platelet lah, darah kuning ialah platelet, darah putih ialah white blood count. Okay, so bila dia turun, okay, darah kuning ni dia punya fungsi utama dekat badan kita adalah untuk pembekuan darah. Okay, so kalau ada luka, kalau ada apa pendarahan dekat kulit ke apa-apa, apa yang berlaku, platelet ni adalah fungsi utama dia adalah untuk memberhentikan pendarahan, lepas itu untuk pemulihan di bahagian tersebut. So what happens? Bila kita dapat dengue fever ni, apa berlaku ialah platelet kita ataupun darah kuning kita akan menurun dengan mendadak. Okay, pada fasa mana dia akan menurun dengan mendadak? Dia akan menurun dengan mendadak pada fasa kritikal, iaitu pada hari ke-4 ataupun dan hari ke-5. Mungkin kadang-kadang hari ke-3 pun kita dah boleh detect dah. Okay? So, bila darah kuning kita rendah, kita akan dapat pendarahan. Alright? Okay, so pendarahan ni boleh berlaku dekat mana-mana ya. Mungkin dekat otak boleh, mungkin dekat perut boleh, mungkin dekat paru-paru boleh. Okay? Alright, itu adalah satu. Nombor 2 ialah efek kepada hati dan juga buah pinggang. Okay, so hati dan buah pinggang ni disebabkan oleh kekurangan air di dalam badan kita. Okay, another thing that we have to understand in dengue fever is not only bleeding ya. Dia juga boleh menyebabkan kekurangan air yang begitu kritikal di dalam badan kita disebabkan oleh jangkitan dengue fever. Maksudnya saluran darah kita akan kekurangan air dan badan kita secara keseluruhannya akan berada dalam keadaan di mana kita kekurangan air sangat. So bila kita berada dalam status begini, alright, buah pinggang kita terpaksa bekerja dengan lebih keras lagi. So seperti mana-mana organ yang lain, kalau keadaan kekurangan air dalam badan kita berterusan pada masa yang berpanjangan, dia akan menyebabkan buah pinggang kita pun rosak. Okey. Selain daripada itu ialah kerosakan pada hati, liver, alright, yang ni disebabkan oleh jangkitan denggi by itself. Alright. So, kita boleh dapat pendarahan, kita boleh dapat kekurangan air yang sangat kritikal di dalam badan kita, kerosakan kepada buah pinggang, kerosakan kepada hati, juga boleh menyebabkan komplikasi kepada jantung dan juga kepada otak. Okay. So, kesemua-semua komplikasi yang saya sebutkan tadi boleh berlaku pada fasa kritikal. So, disebabkan fasa kritikal ni begitu penting, alright, kita kena buat beberapa ujian darah, kita kena ambil BP, kita kena buat ultrasound untuk tengok di manakah berlakunya komplikasi-komplikasi yang saya sebutkan tadi. Alright. Sebab tu bila patient datang kepada hospital ataupun kepada klinik, alright, doktor akan buat ujian darah pada hari ketiga, dia akan tengok sama ada ni denggi ke bukan denggi ke, confirm ke tak confirm. Lepas tu dia akan buat cek darah tiap-tiap hari. Kalau tak masuk hospital lah, dia akan suruh you datang balik tiap-tiap hari untuk ambil darah dan cek sama ada darah kuning tu tengah menurun dengan mendadak. Okay. So, selepas 48 jam daripada fasa kritikal, iaitu hari keempat dan hari kelima ni, alright, you akan masuk kepada recovery phase. Recovery phase basically is just recovering. So, air yang terkeluar daripada saluran darah akan diresap semula kepada saluran darah. Okay. Kalau kita dapat memberi air yang secukupnya dalam badan kita, then all the fluids, platelet dan sebagainya akan bertambah baiklah. Dan bacaan darah kuning dengan darah putih akan juga meningkat selepas tu. So, biasanya recovery phase ni sebenarnya dah boleh balik lah. Right? Okay, so we move on to next slide. So, what is the role of emergency department ataupun klinik-klinik yang berada di sekitar? Alright, first kita kena identify sama ada denggi ni ada demam ni adalah denggi ke tidak. Penting ya. So, bila saya sebagai doktor pelatih sebelum ni kan di Hospital Klang, pakar saya pernah bagi tahu, sesiapa yang datang dengan komplain demam ni kan, dia adalah denggi selagi you boleh buat test dan mengatakan ini bukan denggi. We treat everybody as though it is dengue unless it's proven otherwise. Okay. Nombor dua, kita kena pastikan sama ada ini adalah dengue yang stable ataupun dengue with warning sign ataupun is a severe dengue. Dan ketiga adalah we give treatment according to the status of the patient. Alright, next slide. Okay, so ini adalah ulangan sahaja. So I just go through back. Acute febrile phase ataupun fasa pertama is basically your headache, retroorbital pain ataupun sakit di belakang mata, alright, myalgia sakit otot, arthralgia sakit tulang, mungkin akan ada ruam, kadang-kadang tak ada ruam, okay, dan juga leukopenia. Leukopenia ialah sel darah putih yang rendah. So, bagaimana kita check? Kita buat blood test dan juga dengue test kit. Okay, next. Okay, so bila kita dah jumpa dengan doktor, kita dah buat ujian dengue test kit tu, okay, dengue test tu, dan kita dah pasti sama ada ni adalah dengue fever ke tidak. Next, dekat hospital ataupun klinik, apa yang diorang akan buat ialah diorang akan tanya beberapa soalan kepada pesakit, and then we want to know whether you have any warning sign. Okay, alright, warning sign ya. Warning sign ni sangat penting. Saya rasa semua public should know what is warning sign. So, the awareness of this warning sign actually makes a lot of difference. Sebab apa? Sebab bila you ada warning sign ni, itu adalah tanda-tanda yang mengatakan bahawa pesakit itu terpaksa ataupun perlu pergi ke hospital dengan keadaan segera. Okay? So what are the warning signs? First is abdominal pain, sakit perut. Okay, alright. Any sort of sakit perut di bahagian atas, tengah, bawah, tak kisah. Tapi kalau sakit perut, it is considered as warning sign. Number two is persistent vomiting. Yeah, persistent vomiting and persistent diarrhea. Or and. Okay. So kadang-kadang pesakit akan ada muntah saja. Kadang-kadang pesakit akan ada cerit berit je. Kadang-kadang pesakit akan ada kedua-duanya sekali. Okay. To be more exact, okay, persistent vomiting or diarrhea ni kena lebih daripada 3 kali dalam sehari. Okay. Alright. So itu adalah warning sign yang kedua dan ketiga. Alright. Now the third space fluid accumulation. Apa maksudnya? So ingat tak, I just told you just now that you will be in a dehydrated state. Alright. And all the fluids in your blood vessel will be out from your blood vessel. And where does it go? It goes and accumulates in your cavities, like in lung, in your heart, okay, in your stomach. All right. So these are the places there where the fluids will be staying. Okay, bertakung di situ. Now, how do we know whether there's fluid accumulation or not? The only way to find out whether there's fluid accumulation or not is to ultrasound test. Okay, so untuk dengue ni takkanlah untuk all the dengue patients you want to do ultrasound, doctor, kan? So in emergency department, most of the emergency department, kita akan ada ultrasound where we do emergency ultrasound. Maksudnya lah apa? Ultrasound tu adalah untuk ujian-ujian seperti ni. We will do the ultrasound to see whether there's any fluid accumulation or not in the cavities. Alright. Kelima, spontaneous bleeding. Okay. This spontaneous bleeding can come from your nose, your gum, or sometimes from your stomach if it's visible lah. So kadang-kadang kita gosok gigi, kita akan ada pendarahan. Okay. Kadang-kadang tak gosok gigi pun mungkin akan ada pendarahan pada gusi. That is spontaneous bleeding. Okay. So kalau ada simptom macam tu, maksudnya it is considered as warning sign. Okay, lethargy, restlessness, confusion. Lethargy, sangat-sangat penat, sangat-sangat weak, alright. Resah, restlessness, and confused. Okay. Kadang-kadang bila you tanya dekat pesakit, Encik dekat mana ni? Dia tak boleh nak jawab. Alright, dia tak pasti dia dekat mana. Alright, this is confusion. So if any of your family member who's very lethargic, tak boleh nak bangun daripada katil, cannot eat, cannot drink, it is considered lethargic, then it's a warning sign, restless and confusion as well. Okay, tender liver maksudnya lah apa? Tender liver is pain at your right upper side of your abdomen is where your liver is situated. So when you have pain over that region, it is also considered as warning sign. Okay, last but not least ialah hematocrit dengan platelet lah, iaitu sel darah kuning yang rendah juga dikatakan sebagai warning sign. So yang ni kalau public they won't be able to estimate, but this is where the doctors will do the blood test and then they will see what is your platelet count. Normally, any platelet count which is less than 100 is considered as low, all right? Anything more than 100 is considered still okay. All right, the normal count should be anything more than 150. All right, next slide. Okay, so just to go through back all the warning signs just now, okay. Note here, vomiting is a strong indicator of severe dengue, okay. Presence of warning signs are strong indicator of severe dengue. Okay, so remember all the warning signs that I actually mentioned just now, all right? So all these warning signs, if you have it, most likely, okay, you will end up having severe dengue or dengue shock. Okay, so if you have any one of these symptoms, please go and get yourself checked at your nearest center, which is convenient to you. Okay, next. Okay, so bleeding tendency, right? Like what I said is red spots or patches on the skin, okay, bleeding from the nose or gums, Vomiting blood maksudnya you have bleeding in your stomach, okay, muntah darah. Black colored stool, okay. Bila kita membuang air besar, then the stool color is black, hitam macam rambut. Okay, heavy menses or vaginal bleeding if you're having menses at that point of time. So what does heavy menses means? Meaning that if your normal menses flow is about 3 days and you change about 2 to 3 pads a day, but during dengue fever infection, it may prolong to 5 days or 6 days or 7 days, and you may change about 5 to 6 pads a day. So that is what is considered as heavy menses. Okay. Now, very important point that I want to make over here is this. If you were to see, do not take painkillers. Okay, so I want to make this a very important point to all the public here because taking painkillers when you have dengue fever will actually cause or will give you higher chances of bleeding. Okay, saya faham bila dapat dengue ni memang sakit otot, sakit badan tu memang sakit sangat. Very painful. It's like people has beaten you up. But you are not advised to take painkillers because the painkillers can aggravate bleeding tendencies. You understand? Painkillers. So the only medicine that you can take for fever and your body ache at this point of time when you have dengue is actually your Panadol or paracetamol. Okay? All right? So next. Okay, so what are the investigation we do in the hospital on in the clinic? Okay, kita boleh buat dengue test kit. Dengue test kit ni kita ada dua jenis. Satu ialah NS1, satu ialah IgG IgM combo test. Okay, so NS1 IgG IgM combo test ni adalah untuk mengenal pasti sama ada pesakit tu ada dengue atau tidak. That's the first step. Step number 2 ialah we do full blood count. Okay, test darah yang biasalah. So we will take the blood, kita akan check untuk sel darah kuning, sel darah putih and your hematocrit. Okay, so ini jika pesakit datang dalam lengkungan 2 hingga 4 hari. Katakan dia datang lambat sikit. Okay, kalau dia datang lambat sikit, NS1 kita tak buat, kita buat IgG, IgM saja. Sama dengan darah untuk buah pinggang dengan juga hati. Alright, dan FBC. So, because I told you, right, dekat critical phase, this is where your liver and your kidney and all the other organs are affected. So, this is where we do all the tests. Tapi biasanya kalau datang ke hospital ni, datang pada hari kedua, ketiga atau keempat, kita akan buat untuk ujian untuk buah pinggang dengan hati juga sekali. You know why? Because if there's any changes, okay, in your liver function test or your renal function test on the 4th or 5th day, all right, we will have a baseline to check. Kita tahu, okay, sebelum ni bacaan dia lah macam ni. Hari ni bacaan dia dah macam meningkat sikit. So that are the early indicators, okay, tanda-tanda awal untuk doktor untuk memberi perhatian yang lebih eksklusif ataupun lebih perinci lagi. Alright? So we will monitor this type of patient where there is some slight changes in their blood parameters more closely because we know that there is a chances of this patient to bleed or to be in shock state. Alright? So recovery phase ni biasanya kita takkan buat apa-apa jenis darah lah. Once kita dah tengok platelet dah naik atas, sel darah putih dah naik atas, biasanya kita dah tak ulang balik darah. Tapi selagi kita nampak perubahan yang tu, kita akan ambil darah dan check balik every time. Okay, next. Okay, so what are the treatments modality available for dengue fever? Alright. Basically kan, like I said just now, kita ada dengue yang stable dan kita ada dengue yang tak stable. Dengue yang tak stable ni simple lah, alright. Kena masuk ward. Okay. Dengue yang stable ni, kita cerita sikit pasal dengue yang stable ni. Dengue yang stable ni ialah pasien yang datang dengan demam, tapi dia tak ada apa-apa warning sign, dia boleh makan, dia boleh minum, alright, dan platelet count dia rendah tapi taklah terlalu rendah. Okay, so patient-patient macam ni biasanya kita akan bagi dia balik. right? We'll ask them to monitor at home, and we'll teach them what is the warning sign. And bila dapat warning sign tu, kena datang immediately lah. Tapi dekat rumah tu, kita akan showkan dia untuk ambil paracetamol setiap 6 jam, and then we will advise them to take a lot of fluids. Okay, minum air banyak-banyak. Okay, minum air ni, minum air jenis macam mana? Okay, bukan 100 plus ya. Right, biasanya pernah dengar banyak patient yang tu dapat dengue je dia beli 100 plus berbotol-botol. Actually no. Alright, you can drink normal water, or you can drink any sort of water which is not sweet. Alright, because kalau kita minum air yang manis, apa yang berlaku ialah bila kita air tu yang kita minum tu akan keluar balik disebabkan oleh kemanisan tersebut. Because it's too sweet, okay, the body will excrete more fluid outside. That is how the body works. Okay, so you can drink normal water, you can drink coconut water, you can drink 100 plus, but not only 100 plus. That's what I'm trying to say here. You can drink soup, but janji minum banyak air. Okay, we give a figure more than 2 liters a day. Okay. So this is the management kepada pesakit-pesakit dengue yang stable. This is all it needs. And then you are supposed to come back every day for us to repeat the blood test and see whether your platelet is coming down even lower or is it improving. All right. Or you come back to us immediately when you have any one of the warning sign. Okay, next. All right. So what are the factors contributing to that? Okay. So kalau nak katakan patient presented with severe dengue on admission, maksudnya patient datang lambat lah. Datang lambat, delay in diagnosis, delay in referral. All that about 40 to 60% it contributes to that. Okay. Okay, what is interesting here, you see the severity of illness on admission, warning signs. Okay, abdominal pain, 42%, persistent vomiting, 45%, mucosa bleed ataupun bleeding tendency, 15%, lethargy and restlessness is 39%, with your laboratory, your blood investigation for 36%. So you see, whenever you have this warning sign, the percentage of you or factors that contribute to death in dengue is about 42% to 45%, some are 39%, 36%. Okay, so that is why understanding warning signs for the public is very, very important. Okay, next slide. Okay, so what are the solutions actually? Okay. Before we go to solution, right? So patient who has warning sign or patient who has severe dengue, they're supposed to come to hospital. So I'll just elaborate a bit what we do in the hospital so that you will have an understanding. So lain kali bila pergi hospital tu, faham lah kenapa kita buat macam tu kan. Okay, so patient who needs admission because they have warning sign or they are bleeding or they are in shock state. So normally what they do when they come to emergency department, when they are in severe dengue, first we will start off with fluids. Now, management of severe dengue or dengue shock or dengue bleeding in hospital, dia lain sikit. Lain sikit maksudnya apa? Kita akan bagi air, tapi kita akan bagi air yang secukupnya. Alright? The amount of fluid given to a patient, all right, for patient who have severe dengue or dengue shock is according to their need only. No more, no less. We cannot give more fluids, we cannot give less fluid. So the fluids that we give for dengue patient when they're admitted, it has to be in a proper amount. So how do we do that? We look into your PP, we look into your pulse rate, we look into your hydration status. How do we look into your hydration status? So when you come to emergency department, we have the ultrasound. Remember I told you, emergency ultrasound. We will do an ultrasound and see how dehydrated you are. And then we will give you fluid according to it. Now, this is what have changed in the last 10, 15 years. Those days when we used to practice, there is no emergency ultrasound, so we will give fluids based on our assumption. Okay, so this patient, dia nampak dehydrated, the blood parameter shows like this, so we give this fluid, we give this fluid. Now, the management has been skewed more detailedly now, where we do an ultrasound and we see your hydration status. We know whether you're very dehydrated or moderately dehydrated or not dehydrated at all. So based on that emergency ultrasound that we do, what we do is that we will give the fluid according to your needs. So one patient's fluid regime and the other patient's fluid regime may not be similar. It can be different. Okay. So these are the technical issues that we look. And every hour, the fluid management changes. So first, let's say we give you one regime of fluid, and then we reassess again. Kita kena check balik, and then we will decide. Okay, now I think air dah cukup. Kita kena kurangkan air. Oh, saya rasa air tak cukup lagi ni. Then we will give them more water. Water maksudnya adalah melalui IV drip lah. It's not minum air tau. Okay. Alright. Okay, so that is the first and the most important thing. Number two is that we manage the fever, same like how you manage in your house. We give Panadol either through tablet or through IV injection. All right. And if you are bleeding, then we need to see whether we need to transfuse your blood and some other medication that helps you to improve your liver function. Okay. So these are the technical things that we do for patient who comes and admit to us in the hospital for severe dengue or dengue shock. Okay. Now, so dengue yang stable kita bagi balik, dengue yang tak stable kita admit, dengue yang stable kita suruh minum 2 liter water and then watch out for warning sign. Dengue yang tak stable ni kita akan bagi air, tapi air yang secukupnya, tak boleh lebih, tak boleh kurang. Okay. Now, once we see an improvement in the blood parameters, then kita akan off IV drip dia dan kita akan monitor untuk sehari lagi, then kita akan bagi dia balik. Okay, so these are the management of dengue. Okay, so if you don't manage the dengue appropriately, especially in hospital admission, this is where the patient may deteriorate and it can cause death. Okay, dengue boleh membunuh. So what are the solutions? What can public do to ensure that there is no dengue fever in Malaysia? First, bila anda dapat demam ni, first thing, never assume. Okay, never assume this is going to be a normal fever. Please go and check with your doctors. Whichever place that you're going, doesn't matter. Please check with your doctor and see whether this is dengue or not. Okay. Number two, keep your surrounding clean. Okay, pastikan tak ada air yang bertakung di kawasan perumahan anda ataupun di dalam rumah anda. Okay, because the number one culprit is actually stagnant water. All right. So public awareness, this is what we are trying to do in Assunta. We are giving you public awareness so that you are aware what is dengue fever, how dangerous is dengue fever, dengue fever can kill you or not, and what are the warning signs of dengue fever. When is it that I have to go and check with the doctor? When is it that I have to be admitted in the hospital? What is it that I am expecting if I were to admit in the hospital? Why do they have to take my blood every day, every time to check what is my blood parameters like? So these are the reasons, these are the things, public awareness education that we want to do and give to the public. All right, next. Okay, there is 4 S in fighting dengue. All right, one is search and destroy mosquito breeding site. Okay, seek early consultation. All right, secure self-protective protection measures. This is like wearing proper suits and everything. Support fogging and spraying at hotspot areas. So these are the initiative the government has taken and asked us to do. So what you can do the first 3 S. The 4th S will come from the government side. Okay. Is there any other new medication or new thing that is happening? Because dengue fever dah lama kan. We know about dengue fever. Takkan dengue fever tak ada apa-apa pembaruan from the R&D kan? Actually, there is. Okay. They have recently launched a dengue vaccine. All right. Dengue vaccine is currently available in centers. You can check and see. All right. So this dengue vaccine has proven to reduce infection and also reduce the severity of the disease. Okay. So it is available. It is something new that you can read on, and then you can find out more. All right. And if you are interested, then you can take the dengue vaccine. Other than that, there is no any new development in dengue fever, except we have to contribute from our side on trying to control the disease. Number two, being aware of what is dengue and the severity of the dengue. Number three, seek proper early management when you have fever. All right. So next. Okay, so these are the frequently asked question to me lah. Whenever I go and give lectures to public, these are the things that they ask. First question: when is the best time to do combo test? Like I told you, the combo test is your NS1, IgG, IgM, the combo kit test. It is the best time to do is after day 2 onwards. Okay. After day 2 or after 48 hours of you having fever, you can actually take the combo test and see whether you have dengue or not. In fact, certain centers or certain combo tests can detect dengue as early as 6 hours after the onset of fever. Okay. Now, question number 2, when to come to emergency department? Ini saya dah bagi jawapan tadi kan? Okay. Whenever you have any sort of warning sign just now, you are supposed to go to emergency department immediately. Okay. How much fluid can I take if I have dengue fever? Okay, jawapan dah dibagi tadi. If you are stable dengue, we give a rough estimation, more than 2 liters a day. Okay, bagi dia kepada pesakit-pesakit buah pinggang, pesakit-pesakit sakit jantung, if you have dengue fever, you have no choice whether stable or not stable, you have to be admitted. Pesakit-pesakit ataupun pregnant ladies, okay, if you have dengue fever, you have no choice, but you have to be admitted even if you are stable sometimes. Okay. And also sometimes pediatric kanak-kanak and warga tua, kita tengoklah how is the situation, whether needs admission or not. It's a different this one. So patients who have chronic illness like kidney disease, heart disease, diabetic, you are supposed to go to emergency department when you have fever or dengue fever. All right. Most likely you'll be admitted. Pregnant ladies, you have to be admitted. Pediatric population, kanak-kanak and warga orang tua, please go and see emergency department as soon as possible when you have fever and check and see whether you have dengue or not. Okay. And regarding the fluids, how much fluids can I take when I have dengue? It's 2 liters. Except for patients who can't drink a lot of fluids, like renal failure patient and also heart failure patient. So when should I get admitted? Again, the same question. Number 1, if you have any warning sign. Okay. Number 2, high risk population. Who is high risk population? Patients with chronic illness, heart disease, kidney disease, diabetic, autoimmune disease, or cancer disease. Okay, so these are the high risk population. All right. Also included is the pediatric, warga kanak-kanak dengan warga orang tua. Okay, so this kind of patients we normally admit as because the monitoring for this patient can be very tricky. Okay, how long must I repeat blood investigation if I'm not admitted? Until we see the platelet count going up. Okay, sel darah kuning tu mula coming up to a normal reading. Do all special population needs admissions? The answer I'm going to give you is yes. according to the Malaysian guideline for dengue fever. All special populations needs to be admitted, but sometimes very stable patient, we do monitor from home. But that is for the doctors to decide. Can I drink papaya extract, crab soup, 100 plus only? The answer is no. Okay. No, a lot of people, bila saya pergi kan, dia akan tanya, papaya extract helps to bring up the platelet, right? Crab soup also, right? Actually, sebenarnya, there is no any proper studies done. Okay. So to support the paper to say that the papaya extract or the crab soup actually increase uh, the platelet count, it doesn't. Okay. So, but papaya extract ni no harm drinking lah. Crab soup is no harm drinking. 100 plus is no harm drinking. But in the moderated amount. Don't only depend on papaya extract, soup, crab soup, and 100 plus. Okay, like I said just now, you have to drink normal water. You can drink coconut water. You can drink soup, any other soup you can drink, but just don't only drink these three things. Okay, then the eighth question, is there any dengue vaccine? I have given the answer. Yes, there is available dengue vaccines in the market, which has shown in the studies that it is efficient in controlling the disease and also reducing the severity. Okay, next. Oh, all right. So we have dengue vaccine in the hospital. If you're interested, you can always give a call and then ask more question about it and see whether you're interested or not. Okay. I think with that, my presentation for dengue fever is up. So now I open the floor for any questions if there is. If not, can we go back to the warning sign slides? Next. Yeah. So I'm going to leave this slide open for you all so that you can always remember. Okay, there's someone from Hana. All right. Okay. Hi, Doc. Thank you for sharing. May I ask, if my daughter has already had dengue fever, can she still take the dengue vaccine? If yes, how long should she wait before get vaccinated? Okay, so the recommended age for dengue vaccine is 18 and above. If she had dengue, you have to wait for at least 3 months after the infection. After the infection of 3 months to 6 months, then you can start taking the vaccine. All right. So that is the answer for it. Thank you, Hannah, for the question.
Okay, thank you, Hannah. I think, Doctor, we have another one question coming from Facebook.
Yeah.
So it's in Malay. It says here, Doctor, sebenarnya jus betik dan sup ketam boleh diambil atau tidak? Sebab dulu saya pernah kena dengue. 3-4 hari juga di hospital. Doktor dan nurse tak bagi minum atau makan.
Okay. Seperti yang saya cakap tadi kan, sup sup betik dia cakap. Sup betik. This is the first time I'm hearing sup betik. Is it?
Sorry, it's jus betik dan sup ketam.
Oh, jus betik dengan sup ketam. Okay, it's not jus betik if I'm not mistaken. It's papaya extract. It's from the leaf if I'm not mistaken. Tapi whatever it is, right? Sebenarnya kan dia tidak ada apa-apa sokongan daripada kajian yang mengatakan bahawa jus betik dengan sup ketam ni akan membantu untuk meningkatkan sel darah kuning anda. Okay, ini adalah fakta. Okay, so jika sesiapa individu ada claim dia akan meningkatkan ni, mungkin tiada kajian yang lebih sepenuhnya lagi lah, alright. So, setakat ni daripada apa yang kita dapat tahu, kedua-dua bahan tersebut tidak akan memberi apa-apa efek kepada peningkatan sel darah kuning anda. Tetapi jika anda minum jus betik dengan sup ketam ni, it is air lah kan? It's some sort of fluids that you're drinking. So, go back to what I said earlier. The main mode of management, okay, adalah air. Alright, so minum sup betik ke, jus betik ke, sup ketam ke, it is still fluids that you're drinking. Tetapi, please jangan sekali-kali hanya minum yang itu sahaja sepanjang you ada dengue tu. Itu salah. Bolehlah minum satu hari ni saya rasa nak minum sup ketam lah hari ni, minum. Tak apa, tak ada masalah. Hari ni saya nak minum sup betik lah. Okey lah, tak apa, tak ada masalah. Okay, boleh je. Tapi janganlah minum yang itu je. Right? You have to drink other things. Okay? And also 100 plus biasanya dia akan bagi tahu dah dapat tinggi je minum 100 plus. Okay? Saya pernah tengok patient bawa 3-4 botol letak dekat tepi dia orang, lepas tu minum 100 plus je. It's wrong. You're not supposed to do that. Okay? Drink like normal and you can supplement all these things with this. Tapi untuk soalan anda, boleh minum ke tak boleh minum? Boleh, tetapi dia tidak akan menyokong ataupun membantu untuk meningkatkan sel darah kuning anda. Penting untuk anda faham ni. Okay, so I hope it answers the question.
Okay, thank you, Doctor. I think your explanation throughout has been quite clear, very clear and concise. Maybe
I can't hear.
I was on mute, right? Apologies. Okay, once again, let's bust a common myth. Doctor, is it true that once you recover from dengue, you're immune for life? So what's the real answer to this?
Okay, so the answer to this is we have 4 types of dengue. Okay, the dengue virus got 4 types. Dengue virus 1, 2, 3, 4. So you have 4 times chances of getting dengue in your lifetime. Okay, so let me explain in a bit more detail. Let's say you get a dengue now and your dengue virus is dengue virus 1. Okay, you will never get dengue fever because of dengue virus 1. But you can get dengue because of dengue virus 2 or 3 or 4. So, faham ya? So, dia ada 4 jenis virus. You boleh dapat 4 kali jangkitan dalam seumur hidup anda. Tetapi kalau dah dapat sejenis tu, you takkan dapat balik dengue fever, demam dengue disebabkan oleh virus jenis yang nombor 1. Faham tak? I hope that answers.
Yeah, it did. Okay, I think there is no more questions from the floor.
Okay.
So thank you so much, Dr. Ganasan, for your valuable sharing today. And a big thank you to everyone who tuned in, asked questions, and also helped to spread awareness about this dengue fever. If you found today's session useful, you can still share this on your timeline, Facebook timeline, for more people to learn from it. And if you need more information or any medical support, feel free to reach out to Assunta Hospital. Our dedicated team is always ready to help. So until next time, stay alert, stay safe, and take good care of your health. See you again.
Thank you. Bye.
Thank you, everyone.
Good job.